So just a quick introduction, and appreciate Adriana handling all of the kind of responding to folk in the chat and putting the link in there. And all of the resources that you see linked throughout are available through our library guide, and we'll also share the slides afterwards, so you have it as a reference. So with that grounding in reproductive justice and its history, just wanted to sort of introduce the definition from Sister Song, which is a national membership organization formed in 1997 from that development, that 1994 development of the concept of reproductive justice, with the goal of creating a national multi-ethnic reproductive justice movement. So Sister Song defines reproductive justice as the human right to maintain personal bodily autonomy, have children, not have children, and parent the children we have in safe and sustainable communities. And then some other terminology that is significant for this work are the ideas of birth justice and birth equity. So birth justice, defined here by Voices for Birth Justice, which is a campaign to raise awareness of racial inequity in preterm birth outcomes, based in Fresno, Oakland, and San Francisco, and initiated by the UCSF Preterm Birth Initiative. As they describe, birth justice is a movement that believes when birthing people recognize their innate power to make the best health decisions for themselves and their families during all stages of pregnancy, birth, and the post-birth period, that power will have a transformational impact on their family and communities. And the long history of trauma and reproductive oppression that Black communities and other underserved groups have experienced is the constant force that drives and shapes the birth justice movement. And then relatedly, birth equity, described here as defined by the National Birth Equity Collaborative, which is an organization established in 2015, founded by Dr. Joya Career-Perry, and created to combat initially the rising rates of infant mortality within Black and Brown communities, and then expanded to also include a focus on the maternal mortality crisis. They define birth equity as the assurance of the conditions of optimal births for all people with a willingness to address racial and social inequities in a sustained effort. And so, as you know, hopefully you can see as we're going through these ideas and definitions that we're not just talking about what goes on in the immediate periods of pregnancy and birth and the post-birth period, although those are central to all of these realities and ideas. We're also reflecting on the social and structural determinants of racial inequities in infant and birthing person outcomes. So what you see here is the the framework created in 2016 by Jessica Roach, called the Restoring Our Own Through Transformation, or ROOT theoretical framework, that shows through the interconnections of structural factors, which are the squares you see on the outside, right? Realities of slavery, Jim Crow, the GI Bill, redlining, and the 13th Amendment, and how those influence the social determinants of health, which you see in the circles in the inner part, right? Those are the conditions in which people are born, grow, live, and work. And all of that, those interconnected influences result in increases in maternal and infant mortality. So we think not only of those social determinants of health, but also the structural determinants, the cultural norms, policies, institutions, and practices that drive the distribution or maldistribution of structural determinants of health, as defined by Dr. Career-Perry et al. In their 2021 piece. And last but not least, the core concept, which you'll see a lot of examples of in the film, is the idea of obstetric racism. And so this concept this idea as a concept was coined by Dr. Dana Ain Davis in 2019. And it sits at the intersection of obstetric violence, which is specific gender-based violence experienced by people giving birth, and medical racism. The reality when a patient's race influences medical professionals' decisions and interactions with folk to ultimately cause harm to patients. And so the ways in which obstetric racism may manifest include diagnostic lapses, right? Because of the uninterrogated belief that Blackness is pathological, as opposed to the recognition that race is a social construct. And so this belief leads them to de-emphasize, exaggerate, or ignore a patient's symptoms, resulting in an inappropriate or lapsed diagnosis. Neglect, dismissiveness, or disrespect, when medical professionals do not pay attention to a person in need of reproductive care or treat them with disdain. Intentionally causing pain, so when medical professionals fail to appropriately manage pain, which may be rooted in racialized beliefs about pain immunity and the absence of empathy for Black people's physical suffering, leading to a lack of internal motivation to alleviate or reduce Black suffering. Coercion, when medical professionals perform procedures without consent or intimidate patients into making decisions. Ceremonies of degradation, the ritualistic way in which patients are humiliated or shamed, and this includes a sense of being sized up to determine the worthiness of a patient or their support persons who may be viewed as a threat. Medical abuse, which can occur when medical professionals engage in experimentation or repetitive behavior that is motivated not by concern for the patient, but serves to validate the clinician's self-worth and uphold their domination over the patient. And racial reconnaissance, describing the Herculean effort that Black women make to avoid or mitigate racial encounters, including having to be hypervigilant about procedures and finding providers. And this understanding and this conceptualization of obstetric racism is grounded in the lived experiences and voices of Black women and what they have gone through, and Black birthing people. So with that as some grounding context and to hopefully contextualize this powerful film that we're going to see, I'm going to go ahead and stop the video, and we're going to stop the recording so that we can, or pause the recording so that okay. Hi to our folks on Zoom. Hi to our folks in the room. We do have some reflection scheduled, but we're an intimate group. We can start recording again, maybe. Awesome. Okay, cool. I just would love if we could go around, so in the chat for our Zoom friends and just in the room, just say one word that describes how you're feeling right now, having watched this film. And I'll come to you all who are here so that our Zoom friends can also hear you. Tiffany says, tired. We've got. So we see in the chat, we have tired from Tiffany. Brittany says disappointed. Dawn says devastated. Moni, and my apologies if I'm mispronouncing your name, says sad. Crystal says shocked. Brittany says angry. Adriana says heartbroken. Preston says disappointed. I'll say for myself, I still haven't thought of a word. Yeah, what about y'all? Are you open to sharing? It's okay if not. Yeah, I'm just gonna, so our friends can hear you.
I definitely feel heartbroken.
Yeah, absolutely. No pressure.
I feel disappointed.
Yeah, disappointed. It's okay if not.
I'd say disappointed also.
Yeah, disappointed, heartbroken, angry. I think I'll sit with angry. That's probably coming up the most for me. And it's, I mean, to say nothing of just the power of story and the power of folk, you know, making out of horrible situations, sharing their story so that we can be part of what comes next. So thanks for that impromptu addition. So what we were hoping to do for reflection is just give some space for all of us to think about 3 questions. So what surprised you, or what are you taking away from this film? What questions do you still have, or what questions came up for you? And what can you do to be part of the change? And so because we're a small group, if y'all want to also join via Jamboard, you can, and we can just all Jamboard it up. Okay, sounds like that's going to be what I think they. Okay, got it. Okay, so yeah, we also have sticky notes, and the hope was that maybe you chat with your neighbor, think about these 3 questions, and then we will ultimately gather all of this on the Jamboard. Thank you, Adriana, for putting it in the chat. I'm gonna open it up. And as you know, right, Jamboard, it's anonymous. And so you can see the structure. We've got 2 spaces for question 1, 2 spaces for question 2, and 2 spaces for question 3. And I would just ask, you can either use text boxes, or the sticky note function is often the easiest. So I will stop talking now, and I know, so please keep adding stuff if you are, but let's see what folks shared. So in terms of what surprised you or what you're taking away, we've got what I added about the power of stories and people's strength going forward from tragedy. The statistic that Black mothers are 243% more likely to die from pregnancy-related causes was shocking, absolutely. To be cautious of medical providers being a Black woman and realizing how important and impactful telling your story can be. So a light and a dark in both, yeah. I was not surprised, but a takeaway was the importance of Black people in medical fields to support others, diversifying the workforce and recognizing that these are institutions that have been built on institutional and structural racism. And so how do we work within and through them? Also for Black women to vouch for their health and make sure that they are well treated. Absolutely. None of this is new information. It bothers me that we just keep talking. I want to see action. And we got a +1 to this. At the end, we'll share some of the current actions that are going on, but that more and consistent and absolutely. Education and income do not positively affect Black maternal mothers' outcomes. It is a system issue that needs to be fixed. And what surprised me was the magnitude of the disparities that existed between Black and white women in maternal health. I knew that disparities existed, but not to this magnitude, and how high the mortality rates for Black mothers and babies are, and complications. And then we have one more over here. What shocked me was learning about the mortality rate of African American women. Absolutely. It is shocking and disappointing and sad and infuriating and not new, but remaining horrible. Horrible that it isn't new and that it continues. So then some questions that people have. How can we help if we're not doctors or nurses? Absolutely a wonderful question. What advocate groups and movements exist to support today, to support African American mothers, especially for women who are impacted by the medical system? What can I do?
How can we as students help? How do we push through radical change in a divided country? What steps can be taken to change how the medical field treats Black women and other minorities? How can we get their care to be more equitable? So all of the questions really grounded in where do we go and how do we do it? And so some initial thoughts of that from an individual perspective, right? So support current proposals. I can educate myself on this topic, raise awareness of this issue, share with others, and even advocate for women who are not able to do so. As a Black woman, I feel like I can use my voice to talk about this, but also I feel like I don't know what else I can do. And that is a heavy burden also to be holding the reality of this and also moving forward through it. So yeah, there's layers. What I can do is use my voice. I can speak up on those issues to spread awareness, and I can try to use my voice to spread awareness and message, but would still ask myself, what more can I do? Just making sure I haven't missed any. Thanks, everybody. Absolutely. So really appreciate everyone's reflections. Really appreciate everyone, being here and going through this together. So I did just want to close out by connecting this to California, right? Connecting it to the reality in our own state, and also share a variety of organizations and opportunities, just the tip of the iceberg, because I think we all are in that space, right? Of where do we go? So the first thing is just to share the reality in California. So we were a lot of the folk who shared their stories were from different parts of the South, and to recognize that even in California, and we also had some statistics from New York as well shared. So this is the sort of most recent public data I could find, that Black birthing folk are 3 to 4 times more likely to die due to pregnancy-related complications as compared to all other groups that are included here. And specifically, California uses the pregnancy-related mortality ratio, which actually observes deaths within a year of pregnancy due to pregnancy-related complications. So maternal mortality calculations may not always do that. And so it's a recognition that complications from pregnancy and mortality can happen farther out from the immediate birth. And then severe maternal morbidity, which is made up of 21 different either life-threatening complications or life-saving interventions having been used in the hospital. Here we also see, and this is a significant risk factor for maternal mortality, we see this inequity persist. We see horrifyingly the rate of severe maternal morbidity increasing overall since 2008. But that for Black birthing folk and for American Indian or Alaska Native individuals, the rate of severe maternal morbidity per 10,000 births is higher, significantly higher. All right, so just to add to what we learned and what we saw from the movie, just to connect it to California. So going forward, this quote comes from a powerful report created by the UCSF Preterm Birth Initiative and First Five Center for Child Policy in 2022. Solutions that truly aim to address racial disparities in maternal and child health outcomes must include the communities that are most impacted every step of the way. Birthing people with lived experience can guide healthcare systems and policies to better support and respect communities of color throughout pregnancy, birth, and beyond. So one big answer to what can we do going forward is to center the lived experiences and expertise of those most impacted by these issues. And that's in policy development, in program development, in research, all across the board. And so in this same in this same document, which the link is here, it's also on our website, they go through key recommendations to address anti-Blackness related to these inequities, as well as what work is already going on in these areas. So it's an amazing report. Just going to walk through the big picture of the recommendations. First, provide respectful care that is free of anti-Black racism to the birthing person as well as their support network. Boost effectiveness of anti-racism training to focus on addressing anti-Blackness, promoting action, and producing meaningful results. Strengthen recruitment and retention strategies to increase the number of Black professionals who interface with Black birthing people and communities. So coming back to that recommendation or that question that folk had and that sort of recognition. Improve data collection, accuracy, interpretation, dissemination, and utilization practices. Enhance perinatal and postpartum support to fully meet the needs of Black families. And prioritize collaboration to create mechanisms that lead to systems change, solutions, and quality improvement. And this is just one example of a powerful report, collection of policy recommendations and proposals that exist, that are developed by Black birthing folk and their allies. Relatedly, we have the Black Reproductive Justice Policy Agenda, which was developed in 2021 by a convening through In Our Own Voices, the Interfaith Voices for Reproductive Justice and Sister Love, created back in 2021. And I just want to show you the list of the policy recommendations to demonstrate how we're talking about social and structural determinants. We have to, in addition to and alongside the realities of what folk face in the healthcare setting, right? So policy recommendations are included in this powerful agenda related to sexual and reproductive health all across the board, but also social justice, community justice, and safety. And so I just want to, highlight, right? We need to be talking about LGBTQ plus liberation. We need to be talking about and addressing sex work, the reality of police violence, right? All of these realities are connected to the persistence of these inequities. And then also reflecting on religion and reproductive justice, right? Recognizing the need for comprehensive sexual health education and being mindful of potential for discrimination in the context of religious perspectives, right? So it's another powerful agenda. And then just yesterday, or 2 days ago, excuse me. Yes, 2 days ago, just on Tuesday, as part of the launch of Black Maternal Health Week, Black Mamas Matter Alliance hosted a virtual rally and introduced their new policy agenda, which you can check out. You can also watch the virtual rally. And so this is a comprehensive and values-based policy agenda that includes addressing policy issues around structural and social determinants of Black maternal health, the need for full spectrum maternal, sexual, and reproductive health care, Black maternal, reproductive, and perinatal workforce development, criminalization of Black women, Black birthing people and families, and research and data transformation, and Black women and birthing people's leadership. So the question of what can we do, especially if we're not in a healthcare setting, what can we do as students, right? In addition to learning about these issues and sharing it with others, is to learn about the policy recommendations and programs that do exist. And then how do we, through our voting, through our advocacy, how can we be part of promoting the continuation and implementation of these issues? And there is federal support for this. We know we have a very divided country, and legislature and executive, issues and all of that, judicial system. But
In honor of Black Maternal Health Week, we had a proclamation from the White House, which you can see. There was also a resolution passed by the House of Representatives in support of addressing racial inequities in birth outcomes and birthing person outcomes. And there is the Black Maternal Health Caucus continues to push for change, including the Momnibus Act. So the Black Maternal Health Momnibus Act, which was initially introduced in 2020 by the Black Maternal Health Caucus, which itself began in 2019, and then was reintroduced in 2021 with Senator Cory Booker, Representative Laura Underwood, and Representative Alma Adams, all being central sponsors and advocates for this bill, and the architects of this act, rather. And this act is actually a collection of 12 bills, a comprehensive package crafted to eliminate racial disparities and improve maternal health across the board. And so one of these bills has actually already been signed into law. It's the Protecting Moms Who Served Act of 2021. But the remaining 11 bills, they have been brought into, several of them were brought into the Build Back Better policy, which ultimately did not pass, but there is ongoing movement to continue to advocate. Experts have crafted policy solutions, have thought through the ways in which you could implement them, right? They exist. So how do we make it happen? And California actually was able to pass their own Momnibus Act in 2021 to address disparities in maternal and infant health. This was authored by State Senator Nancy Skinner, and it includes Medi-Cal coverage, for doulas. So we heard in the video, right, the idea of Medicaid expansion, making sure that those who are on Medicaid have full and supportive coverage. So this bill actually does include some of that for California, right? Medi-Cal coverage for doulas, an extension of Medi-Cal postpartum support up to 12 months, which we heard about in the film, increasing access to public assistance programs, and actually piloting a minimum income strategy as a way of addressing racial inequities in birth outcomes. So those things are underway, and we will keep learning from them. And then, of course, there are local groups, local organizations, and work specific to California that you can get involved with, and you can learn about, and you can be part of supporting. So hashtag Deliver Birth Justice is a campaign based in Alameda County, Contra Costa County, Santa Clara County, San Francisco County, and Solano County. You can check them out. They are linked on our on the guide. Expecting Justice is a San Francisco collective led by the California Department of Public Health and the San Francisco Department of Public Health to improve maternal and infant outcomes among Black and Pacific Islander people. Voices for Birth Justice, which we introduced earlier. And then within the Santa Clara Public Health Department, the Perinatal Equity Initiative program and the Black Infant Health program are at the forefront of work to address racial inequities in birthing person outcomes in our county, connected to the California-wide Perinatal Equity Initiative. And finally, the California Black Birth Justice Coalition, which is a statewide collective of birth, equity, and reproductive justice experts seeking to create create and coordinate efforts around reproductive justice in California. And so you can learn about this work that's going on and ways to get involved and ways to advocate. So I do encourage you to come back to the library guide, maybe save it as a as a tab on your save it as a bookmark, because we're gonna it's a living document. It's a living site that Adriana and Dawn and Estella are all the curators of in a really powerful way.
Yeah, and then Rachel sends a bunch of links all the time. And oh, perfect. Yes. And thank you, Adriana. And then, of course, we have a couple of other events that SJSU is doing to honor Black Maternal Health Week. You can also on the library guide see other events, and you can link to other events that are happening around the country. But tomorrow at 4 o'clock over Zoom, there'll be a discussion of Black motherhood and challenges of parenting Black and multiracial children, which is a San Jose Public Library event hosted in conjunction with the San Jose State University King Library. And then on the 17th, fantastic Health and Human Services librarian Don Hackman will demonstrate strategies and resources for finding reliable health information online. So this will be recorded and then posted so it's available on demand. So with that, just want to thank the event organizers, Don Hackman, Estella Inda, Adriana Pu, and myself, I guess. And then, of course, the event supporters. Emerald Green, Machandras Watkins, the SJSU King Library, San Jose Public Library, SJSU Black Leadership and Opportunity Center, SJSU Department of Public Health and Recreation, Sigma Theta Psi, Multicultural Sorority, and the Network of the National Library of Medicine, Region 5, for giving us the opportunity to watch this film. And thank you all for joining us, for being part of the movement for birth equity. We look forward to moving forward in solidarity with you all. Thanks, everybody. That's a good call. So we are done, but does anyone who joined us online or in the room have any questions or other comments they want to share before heading out? Got a lot of thank yous. Thank you all for attending.